Idasanutlin is an MDM2 inhibitor. It's an oral drug that's given 5 days out of a 28-day cycle. It's been shown in a phase 1 study that we conducted here at Mount Sinai to induce not just remissions in terms of blood counts and spleen and symptom, but also have significant molecular responses. And this can happen in a relatively short amount of time. It is a drug that capitalizes on the fact that PV is a wild type P53 disease, and that MDM2 inhibitors upregulate P53 activity and induce death in those high MDM2 expressing MPN hematopoietic stem cells. This trial that was predicated on preclinical studies conducted by Ron Hoffman and Min Liu ultimately led to a global phase 2 study of Idasanutlin in patients, 27 patients who had been treated with previous either Hydroxyurea and or Ruxolitinib. And what we saw in that study was the fact that spleen and symptom responses were there, control of the hematocrit level was there, but most importantly, patients had significant reductions in their JAK2 allele burden that were rapid. This indicated that we were really modulating the stem cell in a profound way. So things you would see with interferon in a fraction of patients over a prolonged period of time were achievable in a relatively short period of time with an oral MDM2 inhibitor. The problem that we faced and that we documented both in the phase 1 and the phase 2 is it does become difficult to repeatedly expose patients to this type of drug month after month for a chronic disease, due to the fact that there is a GI toxicity profile with this drug in terms of nausea, diarrhea, queasiness, even an anticipatory nausea was seen in some patients. And that was challenging to overcome even with antiemetics as a prophylactic measure. So optimizing this class of drugs to avoid those toxicities and able to provide more sustained responses, I'm quite confident would be a valuable endeavor in PV and related MPNs, and MDM2 inhibitors are in active evaluation, both alone and in combination with ruxolitinib in myelofibrosis and in post-MPN AML. So drugs like navtemadlin, which is a Cartos compound, or siramadlin, which is a Novartis compound, are very exciting, and I really look forward to seeing a lot of those mature results come through.